NDP Leader Jagmeet Singh is in Ottawa calling on the federal government to meet with the provinces to address critical shortages in pediatric care in hospitals. Let's listen in.
For healthcare to be in the agreement, that's something very important to us. And to start off with the first question, if we don't see action on healthcare, we absolutely reserve the right to withdraw our support. This is very serious. And we won't make that decision lightly, but this is at the level of seriousness that we could make that serious consideration. We need to see action. And I want to make it clear, just because we haven't seen it, we're not going to give up fighting. We're not going to let the Prime Minister off the hook. We have a tool that we can use to apply more pressure, and we're going to use that tool. We're going to apply pressure. We're going to demand action. There may come a time, though, it becomes clear to us that the Prime Minister and the Liberal government aren't willing to do what's necessary for people, and we will make a very difficult decision at that point. But right now, our focus is we're going to continue fighting. We're not going to back down. We made certain elements very clear because we knew that there were some clear deadlines and clear timelines for it. We knew that in healthcare in general, we wanted to keep it open and flexible because we know for healthcare, there's going to be changing circumstances. And right now, we need emergency relief for our healthcare system. This is not about one transfer to solve it. This is about a national crisis where healthcare workers are burnt out, children's hospitals are overrun, and there's not sufficient resources to deal with the crisis that we're going through. And that's going to require some immediate and urgent steps. And that is completely missing. There is no urgency. We don't see the Prime Minister acknowledging how serious this is. Premiers are completely ignoring how the crisis is hurting families. As Rachel pointed out, this is hurting our next generation. These are children. And I thought it's quite powerful how Rachel talked about children that don't have a voice to say, hey, we're struggling, like we're hurting. These are young children that don't have that voice. We have to be their voice, and we have to demand that the government act now.
And thank you for my follow-up, just very quickly. Are you essentially suggesting, I just want to be very clear on this, because what the impasse is, premiers don't want conditions to funding. The federal government, the federal Liberals want to see a plan. They want to put plans in for specific priorities. Are you essentially telling the government, just negotiate the CHT, get that done, don't worry about the conditions?
I'm saying that this seems to be a bit of a distraction. We got the Prime Minister's talking about, wanting to have conditions. We got the Premier's talking about we want no conditions. And we got kids that are waiting for hours for care. Like none of that is relevant to a parent that has to wait 20 hours while their kid can barely breathe. None of that's relevant to a nurse that's working so hard and is unable to provide the care that they were trained to give. Like this is completely disconnected from the realities on the ground. That's the problem here. Like when you hear a Prime Minister say, of course we want to make sure the money goes somewhere important. We want to make sure the money that's committed to healthcare goes to healthcare. We understand the fears of people in Alberta. When you got Daniel Smith, who knows where the money would go? If you send money to Daniel Smith, no one knows that that's going to go to healthcare. Same thing for Doug Ford in Ontario. No one trusts that that's going to go to healthcare. I understand that. But that can't be an excuse not to act. When we saw the pandemic, we saw the federal government act immediately. When there was a crisis, we saw immediate action. That's what we need right now. This is not just about healthcare transfers. This is about an immediate crisis that requires immediate action and a Prime Minister to step up and show that leadership. And we haven't seen that so far. That's what this is about. And yes, we should be negotiating a better healthcare transfer. We believe that the federal government hasn't been spending enough in healthcare for decades, whether it's Conservative or Liberal governments. But right now, what we need to see is immediate solutions to dealing with an immediate crisis in our healthcare system as it pertains to children. That's what we need right now.
Mr. Singh, JP Tasker, CBC News. On the Canada Health transfer, the premiers want Ottawa to pay about 35% of all healthcare costs in cash, not a combination of cash and tax points, because they transferred some tax points a few decades back. What's your position on that? Do you think that the Fed should spend 35% in healthcare costs?
We've long supported an increase in the transfer. The amount of the transfer, we're open to the Premier's ask. We're open to hearing if there's a counter proposal, if there's different ways to deliver that. But what we're talking about today is not just that we need to increase in a sustainable, long-term way the funding for healthcare and acknowledging that the federal government has been cutting that funding for decades and that we need to reestablish the federal government's contribution, and the Premier's demand to increase it is very legitimate. We support that demand. But what we're talking about in addition to that is the immediate crisis in children's hospitals. That is something that is in addition to the crisis of our overall healthcare system that has been starved of funding. But we need some immediate action to support the training of additional nurses and frontline healthcare workers. We need immediate action to unlock the workers that are in Canada with international training. We need to make sure we're paying workers a good and decent wage. We need some immediate action to deal with the crisis we're up against. But when it comes to the healthcare transfer, of course, we need to increase it. And we think the premiers have been really asking for something appropriate to increase that funding in a sustainable way.
Could I actually ask a question of Rachel?
Yeah.
Next. So you kind of painted a sad picture, dire straits, it seems like, in our healthcare system. What's your message to politicians who are bickering over conditions, they're bickering over a price tag of a health transfer? What do you say to them when you have the stories you have?
They need to sit down and actually listen to us and work with us, because we haven't had that from anyone, particularly my experience here in Ontario. We're not just we're not just fear mongering. This is happening, and we have the solutions. Some of them are short term because we need short term solutions to fix the crisis we're in currently, and some of them are long term to make sure that we don't end up in this crisis again. And a lot of it is to do with retention and respect, which we haven't seen any respect in healthcare for decades, and it's been blatantly obvious in the last 2-3 years. We're recruiting like mad and not retaining, so that's a problem. And we've lost nurses who never intended to leave their career at this point. But because of the untenable work conditions, because of the workloads, because of their personal burnout and moral dilemmas, they're leaving. So not only do we have valuable internationally educated nurses out there who are not working, we have valuable, experienced, knowledgeable nurses out there who are also not working because they couldn't keep it up any longer. When they're taking jobs in Winners and Costco instead of following a career, because that way they can get time off and they don't come home crying because they couldn't do what they needed to do for the patients they saw that day.
All right, we've been listening to Jagmeet Singh, federal NDP leader, calling on the feds to meet with the provinces and territories, those leaders, to address the critical shortages in pediatric hospitals and healthcare in general, taking some questions as well, and using the force of the NDP's confidence and supply agreement with the Liberals to back him up.